I'm gonna record this, and glad you guys are here. I'm gonna go ahead and just share my screen. And say welcome. So who is this for, this knee seminar about knees? So we made this for people who are tired of living with knee pain, people who have been missing out on activities, whether it's going out walking, going on vacations, avoiding uneven surfaces, you can't get off the floor. So people who are just having trouble that's affecting their day-to-day life. People who have stiffness in the mornings or are really stiff after sitting for a long time, that's really common. People who are trying to avoid injections or knee surgery. So that's pretty much everyone that I see. We all are trying to avoid those invasive treatments. Those who have had injections and pain came back, again, I see that a lot, where people will get some sort of injection in the knee and 3 months later, it hurts again. And those who want to just stay active, keep doing the things that they like to do. So this is not for people who have traumatic injuries. So if you fell off your bike and your knee is very swollen, that is not what this is going to address. Or people who've had injuries athletically and felt a popping or a snapping and knee is swollen, can't walk. That's not for you. This is not for you guys. You guys need to go see your doctor for those big injuries. But this is for people who have had this coming on slowly over time, doesn't completely go away. So we're going to go over just some basic anatomy. We'll learn common causes of knee pain, common methods for treating it, and risks and outcomes of surgery, and how to improve your knee pain all naturally. So without pills, medications, procedures, and surgery. Even if the doctor told you it's bone on bone, which is the most common thing that I hear from people. The doctor said it's bone on bone, I need surgery. Okay, well, it may be true, but there's things we can do to improve it for sure. So a little bit about me, if you don't know me very well, I'm Catherine. I'm a physical therapist since 1997. I got my bachelor's degree from Tulane and a master's degree from Emory University in Atlanta. Came back to Louisiana to practice. Opened Blue Wave about 2 years ago with my partner Maureen. She's a licensed massage therapist. She's also my sister. So we have a family business going on. And our mission is to help active adults get back to exercising, feeling fit, and enjoying the activities they love without injections, surgery, or medications. So that is really our goal. And we use lots of different modalities here, treatments to try to get you there. Personally, I enjoy swimming, which is part of the reason why we opened this aquatic center. I have 3 kids I spend time with, even though 2 are, well, one's in college, one's heading there. So I have my little one. So this is my group right here. This is who I go home to and encourages me every day. So on to the knee here. This is just some basic anatomy stuff I'm going to kind of go over so y'all can understand what's going on a little bit better with your own knee and understand why we use the treatments that we do. So this is a healthy knee, an x-ray on the right side here, and just a drawing here. So this includes the knee bone, the femur, and the tibia on the bottom, your kneecap on top. This white part is called articular cartilage, and it's a smooth surface, and that's what helps the bone move back and forth on each other, helps it move smoothly. And then on the bottom side, you have cartilage meniscus. So again, it's a cartilage tissue, but it's soft. It's a little bit softer. So both the articular cartilage and meniscus, they're softer than bone, and they provide kind of a shock absorption a little bit and some protection. And this is, the cartilage is usually where you have arthritis. When you hear those terms, arthritis and bone on bone, it's usually damage in this cartilage. So we'll go through that some more. You also have these big ligaments on the side of the knee, the lateral and the medial, which is another word for outside and inside. And then you have 2 big ligaments that go through the knee joint. So what I wanted to show you in the x-ray here is that all the x-ray shows is the bone. You can't see those ligaments. You can't really see the articular cartilage too much. It kind of blends in. But what you do see is this big open space. And that is a good, healthy knee, that you have this open space where one bone moves on top of the other. And then you have these ligaments that are there, you can't see them, that help support that knee and help create that space. So this is good, this is healthy. On the outside of that knee though, we have all this, and we're not going through all of it in detail, but what I wanted to show you this picture is you have all these muscles and other support that are around that knee to protect it, to give it some lift, and to take some pressure off. So you can see you have muscles that are going this way, and some up and down. You have them on the back, they crisscross, they come from above. Whoops. They come from above, they come from below. And then you also have these thick tendons. And on the outside, you have this thicker tissue, which is your iliotibial band. And you have some of those tendons that come around the front. So there's lots of different places of support and lots of places where you can have injury too. So arthritis, that is the most common thing I hear. And this is kind of a picture of what arthritis looks like. So you have that healthy knee joint with the smooth cartilage, and then you have the arthritic knee. So it's not smooth, it's bumpy, it's worn down. And this is just happens, this is normal wear and tear. So most people will have some evidence of arthritis in their knees, especially after age 40. You may see some changes. Doesn't mean you're going to have knee pain, but you may have some changes in the cartilage. This could be progressed because of previous injuries. It could be progressed due to poor diet. It could be genetics. It could be weight gain, too much weight on the joint. So there's a lot of different causes to have the smooth surface slowly break down. So I'm going to show you a little x-ray of what it looks like. So this one on the left is normal. You have that joint space, and on the right, loss of joint space. You can see how it's literally is bone on bone. So that is where that phrase comes from. So anybody who's been to the doctor and says they have bad arthritis, that is kind of the phrase. And that's what it means, is that you have lost the cartilage and protection and padding between the two large bones in your leg. But what you will see is that it's usually on one side more than another. So one side kind of caves in, other side tends to open up a little bit. Next picture is a real bad case. So this one is really, nothing is smooth at all. This is really collapsed in. The tibia, which is normally flat across, is now angled. And then what happens is the knee joint, instead of being up and down, comes bent. And this is a side view, but again, it's so blurry and uneven, it's even hard to see. So I wanted to show you a picture of what this type of knee looks like. On the outside is what they call a knee varus, or what most people know as bow leg. So your normal knee should be straight up and down. When you have arthritis on the inside of the knee joint, you tend to become bow-legged. If you have arthritis on the outside, it's the opposite way, what they say knock knees. So I have people who have one or the other. A lot of it, again, depends on genetics and weight, and depends on previous injuries. I have one little lady who's got one knock knee. Her right leg is totally swung outside, even worse than this picture. Her left leg's totally straight. So it almost looks like when she's very uneven when she walks, but she did not want to do surgery, and through a lot of exercise and different treatments, she's doing really, really well now. So just because you have these changes, again, doesn't automatically mean surgery, but we want to catch some of this before we get these large changes in our joint. So this slide kind of goes over just a whole plethora of different things that can happen that usually do not require right-away surgery. And they kind of happened over time. These names, some of them may be familiar to you. The chondromalacia patella, that is just almost arthritis on your kneecap. Bursitis is inflammation of the little pillow. Patellar tendonitis is below the kneecap. All these things they're all different types of injuries based on all those different things you have going on with muscle, ligament, and bone. So how do we figure out what the problem is? And a lot of times your physical therapist or your doctor can get a pretty good guess of what's going on based on your symptoms. So you could say, it only hurts when after I've been sitting for a long time, I have trouble standing up, or it only hurts when I do stairs and I squat, or it only hurts if I stand in one place for a long time, hurts on the inside, hurts on the outside. All of those things together really give us a good picture of what's going on. And most of these are not necessarily surgical options. There's lots of things to do before you would even consider that, and things that we want to do to treat these small injuries, kind of micro injuries, before it becomes this huge arthritic knee. So one of the things that doctors are doing now that is more common in their offices and some physical therapy offices is diagnostic ultrasound. So it's a non-invasive way to look inside the knee, with a way to avoid MRIs that are very costly. We don't have one in this clinic yet, but that's something I hope to have in the future. But just looking, you have this ultrasound that just rubs on the outside of the knee, and you get this picture that shows the different structures. And usually when there's an injury, you will see a disruption of the pattern of tissue in the structure. So it's a way to help kind of diagnose and even get a better idea of what's going on. So here's one example of a recent client and family member, I will say. 48-year-old male with medial knee pain, right knee pain, meaning on the inside. I suspected a meniscus tear. He's been having pain for about 3 to 5 years, getting worse after running. So he quit running, decided to ride bikes for a while. It got better, went back to running less miles. It came back. We quit doing anything till the pain went away. Then he started walking and the pain came back. He quit doing anything until it came to the point where it was all the time. So basically, instead of working to improve himself, he kept avoiding activities over time. And then he kept being able to do less and less. So he finally went into the doctor. X-rays show pretty good knee space there. On the right knee and the inside, he's got a little bit less space there. So we suspect the meniscus tear. So the doctor in the office did that check, and of course the doctor has his finger right over the picture, but you can see there is a disruption where there's something missing right there. This client went to, still wasn't satisfied, decided he had to have an MRI, had to know what was going on, and it confirmed meniscus tear. And you know what the doctor told him to do? Go to physical therapy, go exercise. So my point being here is that there's lots of options that are cost effective to try to figure out what's going on with your knee without having to go to an MRI or some invasive procedures. So if you're going to the doctor and are curious, most orthopedics will have this diagnostic in their office. So back to the muscles. All these muscles are supportive of the joint. So the answer to any of those things is you have to do exercise and you have to strengthen around the joint. So physical therapy is frequently the first stop. So goals here, decreasing pain. That's the first thing we want to address. So decreasing pain at home using ice is an anti-inflammatory. Avoiding certain high impact activities. You know, maybe avoiding for a few days the activities that cause you pain, if it's stairs, if it's walking 2 miles, whatever it is, a little bit of avoidance in order to let the pain settle. And then quickly you want to move into restoring your mobility and your flexibility. So frequently with knee pain, people avoid getting the knee all the way straight, that sometimes it causes pain in the joint to go all the way straight. And by avoiding that, it gets tight. So it's real important to stretch your hamstrings and your gastroc or your heel cords. Those are both in the back of the knee. Really important to have full range of motion to both of those. When your knee is totally straight, the quadricep muscle, the big muscle on the thigh, is much more effective and much more efficient. So getting your knee straight is super important. After that, again, restoring your stability, meaning get stronger. not just doing the same exercise. I hear a lot, well, will I walk? I'm active, I go to the grocery store. Well, those are all your regular things. In order to get stronger, you have to step up and you have to challenge yourself. You have to do more than you were doing before, or else it will not get better. And the next thing in therapy that we do, which is really the ultimate goal, is to address balance, being able to do steps, squats, doing the things that you want to do with the knee that's now more mobile, it's stronger. And so now you want to get back to those activities. Massage therapy is another option that people don't really think about as far as knee pain, but it can be very helpful. When you're in pain, your muscles tend to get tight. We all kind of do this, same thing around the knee joint. So massage therapy can relieve some of the tension in those tight muscles that are also causing pain. It improves blood flow. So if you have better blood flow, you're getting rid of the inflammation, the bad stuff, and you're bringing in the good healing tissues. Helps you restore posture. So if you're hurting, we tend to kind of do this, right? Does that make sense? Or you lean off of that leg that's hurting, and then you end up that you're always standing like this, kind of crooked. Well, that leads to muscle tightness in the back, in your hips, all these other places. Then you're creating secondary problems. So massage can help with that. Relieving stress. So if you're having pain and then you're stressed out, it just elevates the amount of pain. So if you want to bring your pain sensitivity down, your perception of pain, dealing with stress is super important. And hopefully your massage therapist will kind of individualize the massage for what your symptoms are. All right, another thing to use are creams. In our clinic here, we use essential oils and we use CBD. We've gotten a lot of success with CBD, especially the muscle rub, which is the cannabinoid. It comes from hemp. We tend to use these products because they're plant-based and all natural. They don't have any chemicals in them. So the ones on the right, so there's oils, there's rub-ons, there's creams. All those are topical and they provide superficial pain relief. The CBD oils go a little bit deeper into the cell structure and they help kind of take down the edge of the nerve endings, so they can really help with pain and some with inflammation. So this is the things that we like to use in our clinic, but there's a gazillion things out there. There's BioFreeze or Tiger Balm or Blue Emu, all that you can get at Walgreens. Most of those are based on menthol. So it's an alcohol type of thing that just creates this cooling effect on your joint to help with pain relief. If that works for you, go for it, use it. I just encourage whatever works for you. And if one cream is not working, there are 50 others that you can try. And if they're able to give you a little bit more pain relief, if they're able to let you get your shopping done without an inflammation, they're totally worth it. And then knee braces. I recently had a client say to me, "You don't really like to use knee braces, do you?" And I kind of had to giggle because my answer was, "You're right, no, I'm not a big fan." But that's me personally coming from a therapy point of view, that a lot of people get secure in wearing a knee brace. They do feel good. They provide compression. They can provide some lift off of the joint. For people who feel unstable, they feel good. So that part of them is great. But for people who just rely on the knee brace, oh, I don't need to do anything else because I have a knee brace that works. What they're doing is they're supplementing their own muscle strength with this outside support. So over time, things are actually going to get worse if you're always wearing the knee brace. So what I encourage people to do is, if you have an activity that is more than what you do on a day-to-day basis, or it's an activity that you know is going to aggravate your knee, that is the great time to put on a brace if it's helpful. So the one on the left is just a very simple knee sleeve we call neoprene. It just kind of slides on. It's not too tight, but just that little amount of compression can be very helpful. For those who have more of a ligament injury, the brace here with these, we call them lateral stays. Those can be helpful, but you can also see that it's bulky and cumbersome. So I find that most people, after wearing it a little while, they don't they'll wear it for a couple weeks and then they just decide it's too much of a pain. It doesn't fit under their pants. It doesn't look good over the pants. So again, kind of personal choice. I put the copper sleeve on here. I do get a lot of questions about magnets and copper. Clinically, I don't see that it makes a huge difference. I don't see that as much in my practice, but there's some people who swear by it. So again, it's kind of like the creams. If it works for you, go for it, use it. And the one all the way on the right is more like an athletic injury type of brace. So normally you won't see that on a day-to-day basis. That's more for people who have had a surgery or need a surgery because of a major injury. So really the most common things for general knee pain or chronic knee pain would be these sleeves. Those are probably the most cost effective. They're not very expensive. They're easy to put on, they're easy to wash, and they do provide some support. All right, orthobiologics. Anybody heard about those yet? That's a big term. It's a fancy term for some of the new research and treatments that are going on with orthopedic doctors. So if you've tried physical therapy, you've tried exercising, you've tried creams, you've tried all these things, you don't want to get necessarily injections that are steroids. The orthobiologics is new research. So it's some biological substances that help to heal quicker. So they are not just to calm inflammation down, they actually are being made to help promote healing with the knee, especially that cartilage. So it may include a bone graft. They call it autologous blood, platelet-rich plasma, which is PRP, which is getting a lot more word, and then stem cells. So the bone grafts is more for a major injury, but the blood transfers is where they, you may have heard some athletes doing this, where they spin down your blood until you get all these red blood cells, and then they add them back to your original blood so that your red blood cells are like sky high, really high, brings lots of oxygen into the area, and they'll inject it back into the area of the injury, hoping that you have this increased healing response. Platelet-rich plasma is another one that they're using, especially for ligament injuries. And again, they take some of your own plasma, they spin it down until getting these platelets out of it, which are help with healing, inject it back to the site of the injury. And stem cells is that they're using some naturally derived cells that automatically their job is to do healing and promote new cell growth. There we go, we got it out. So the problem with the orthobiologics right now is not many of them are covered by insurance, and they can be expensive, but the results that are coming out and the research that are coming out are very promising. So it does involve an injection, it does involve a procedure, but it's usually something very small. It's not very invasive. You're using your own body's natural products and natural healing tools right into that spot. So people who are beginning to have arthritis symptoms, beginning to have these pain, these treatments are much more effective for people who are just beginning than opposed to those who have the bone on bone or look like that picture I showed y'all before. This is not going to help that. But if you catch it early, while you're still pretty mobile, you're still going, these treatments can be very beneficial. So again, if that's something you're interested in, you want to find an orthopedic who does those kind of things. All right, so you've tried everything else. Now you feel like your last thing is surgery. So I wanted to give you a little information about what these knee surgeries look like, especially total knee replacement, because that's really what's going on. The number of total knee replacements in the last 10 years has gone through the roof. One reason is because they are successful. They can be very successful. The problem is when they're not successful, they can be really bad. So we want to, anybody who's considering this, we want to set you up for success. The easiest type of surgery that I just listed up there is the arthroscopic repairs. That's when they stick in 3 little needles into your knee, and a camera goes in there, and their little tools can go in there, and they kind of clean up. They call it, they clean up the mess. So If you have a tear, they kind of saw it down or they smooth out that bone. So that has been a very common surgery, but less and less in the last 10 years, because when they were doing these in the 90s all the time, they said, it's great, you can feel better, we'll get you back on your feet in no time. And that happened, but we're finding that within 3 years, people are having a lot more degeneration of the knee. So it's not really buying time. We're finding that it may be accelerating some of these arthritic changes. So even though it's a much less invasive surgery, less and less doctors are doing it because they're finding that exercise and physical therapy and stretching, all of that can prolong your distance to having a knee replacement even more than some of the previous arthroscopic surgery. The unilateral knee replacement, it's the picture on the left. These are becoming more common because, again, it's a less invasive surgery. And this is where you have the bone on one side and they just fix that one side. I've seen some that have had great results with this. I've seen others that a year later end up going and get the total knee replacement. So again, that's a discussion with your physician on what's the most appropriate for what you have. And then the total knee replacement. So this is the x-ray where you can see the replaced pieces there. And it is metal. It's usually a titanium piece of metal. And they basically saw off the end of the bone that was all bad. I know, I see one of those faces. And that's why I say that, because it's a very aggressive surgery. And they cap it with this now new, nice, shiny, smooth piece. And then on the bottom, they create a new platform and drill that down into the tibia. So now all that arthritis, all those raggedy edges, they're gone. And you have this great smooth knee. So when my clients have this surgery, they come back and they're like, the knee pain I had before is gone, and yay. But the pain they have from the actual surgery is very intense. So I wanted to kind of go through what it looks like before, if somebody is considering this, what to know, and maybe as a way to encourage people to manage taking care of their knees now, so you don't have to do this anytime soon. So depending on a surgery for a knee replacement, you'll be in the hospital for 1 to 3 days. A lot of this depends on your location. When I was practicing in Tennessee, I saw total knees in the clinic the day after surgery. Those people, it was rough. Down here, they stay in the hospital more like 2 to 3 days. Most people will have home health and nursing care for 2 to 4 weeks to help them manage the incision, make sure it stays clean, and to get them moving and walking. Most people start with a walker, progress to a cane, and then ideally to no cane, no walker, nothing. And that process usually takes about 4 to 6 weeks to get off of any kind of assistive device. Then there's outpatient physical therapy. That can be anywhere between 4 and 12 weeks. I'll say it's never been less than 4 for any clients I've had. I've had some that go more than 12 weeks. The first 2 to 4 weeks are very painful, and it's because of all the soft tissue healing around the knee. When they do that surgery, they kind of have to move everything out of the way, and when they put it back together, it's painful. And just like you have an incision on the outside, you have an incision and healing and scarring all the way through. So regaining your range of motion is usually the biggest challenge, being able to bend it. When you have a big incision like that, the last thing you want to do is bend it because you feel like it might open. They never do, but it's hard and frustrating. I actually had a client, somebody called today asking about therapy. She had her knee replacement 2 years ago and she still can't bend it past 90 degrees. So the majority do great, but like I said, when something goes wrong, it is very debilitating. Returning to work and driving, 4 weeks is absolute minimum. Most of them are 6 to 8 weeks. And you have to have good support at home for at least the first month. That's been a challenge, especially for the elderly people who live alone and family may live far away. So that's all frequently a challenge. Full recovery is anywhere between 6 and 12 months. But the big key here is the people who do prehab, which means they get stronger, they stretch, they get their range of motion before surgery, do so much better and have very few complications. So again, even if you have a bad knee, even if you have bone on bone, doing these exercises, getting yourself stronger ahead of time changes everything. So exercise for knee pain relief. I'm going to go through the 5 most common ones that I give that are kind of like the starter exercises to get people going. None of them should cause too much pain, but movement is medicine. It brings blood flow to your muscles. Exercise gives pain reducing endorphins. It builds confidence. And most people feel better after they exercise. So that's one problem with knees is when you don't move them, they hurt. And because it hurts, you don't want to move it. But then it hurts because you haven't moved it. So getting past that initial oomph to start doing something is the hardest part, and then it starts to feel better. But how you do your exercise, it does matter. You want to make sure you do them safely. So if you're having pain, if something seems to be making it way worse, you certainly want to back off and be careful. And you want to make sure that you're doing them correctly, because a good exercise routine makes you feel better and it will have lasting effects. It may last for a day, it may last for 2 or 3 days. The wrong exercise routine will be the opposite. You will have pain for a long time. So you want to make sure you listen to your body and start really slowly. So I'm going to go through kind of my basic starter things that I give people. Hamstring stretch. So like I said, it's we tend to avoid extending the knee all the way, and then our hamstring muscles will get tight. So here's a little video. Can you give me a thumbs up? Can you see the video? Can I get, all right, good. So the reason I like to do it on your back is because when you lay on your back, it gives you a lot more back support. You're not stretching your back. It does not have to be done on the floor. Just because she's on the floor doesn't mean you have to be on the floor. You can do it on your bed or your sofa, whatever. So in this video on the right, she's grabbing behind the knee. And I always say grab behind the knee because you don't want to cram it in the front, and try to straighten the leg. If you have trouble grabbing behind the knee, then you can do the one here on the left and have a belt, a sheet, a strap, something like that, and you can help hold your leg up. So working on that hamstring is super important. Now Laura, my little model here, is super flexible and gets her leg all the way up. I know not everybody will do that, especially if you have knee pain. It won't look like that the first time. That's okay. All right. Next one is a gastroc stretch, which is also called your heel cord. It's the muscle from below the back of your knee down towards your ankle and your Achilles tendon. So again, 2 ways that you can stretch it. One, sitting on your couch, you can get a belt, wrap it around your foot, pull it forwards, or you can stand up against the wall. And I know his feet are cut off, but the important part is the leg and the back, that your heel stays down flat. So you will feel the stretch in the back of the leg. Now, if you have a lot of knee pain, again, this could be painful standing up, and it may be hard to get that knee straight. So the one on the left is a good option to start with. You usually won't get as much pull using the belt and on the left, but it's definitely a good starting point. The other key is to make sure that your knee is as straight as it can be when you do this one on the couch. Okay, moving on. The next one that I start everybody on is called a quad set. So your quad muscle is the big muscle in the front of your thigh, and it is the powerhouse of your knee. So if that is not working efficiently, you will not have good motion in the knee, and you will most likely have pain. So in order to get some pressure relief and some support in the knee, the quad has to be going. Now, when you have swelling in the knee, the quad is the first thing to shut down. It's kind of like this protection mechanism of, I have pain, I have swelling, something's wrong, let's not do anything. But we got to work through that and get that quad muscle going. So really it is just pushing the back of your knee down, straightening your knee as much as you can, and holding it. I always say 5 to 10 seconds. And I do have a sheet for this if ever, you know, that if anybody wants, I can email you a sheet with all these things on it too. So if some people, again, if your knee doesn't want to go really straight, or you don't feel like you're doing anything, sometimes this towel under the knee makes a big difference. It gives you something to feel that you're pushing against. It kind of fills the gap from underneath your knee, and it allows you to get a little bit more power with that quad muscle. So frequently I'll have people start with the one on the right, and once they understand what that contraction is supposed to feel like, then I take the towel out and do the one on the left. Again, you don't have to do it straight sitting up. If you have any kind of back problems, this one I would recommend just laying flat so you're not pulling on your back. Okay, and this is the next major one, the straight leg raise. Now, the biggest problem that people do with this one is they think that they're Rockettes, and they will kick that leg way up and down, up and down. But the important part really is slow and controlled. So to note in this picture, his foot and toes are kind of pulled up. So his knee is locked really straight. And then you're going to lift no higher than the opposite leg. So in this picture, he's kind of halfway there. I would not recommend even going much higher than he's going. And by staying in that smaller range, you are forced to really do a lot more work. The Rockette kicks, you use momentum and you swing that leg up and down, and then the knee tends to bend, and you're really not doing yourself any service there. So slow and controlled, not going up very high. Okay, now this one works the hip. And I put this on there because most people don't realize that a lot of knee pain is due to weakness in the joints above and below. So the hip bone and the ankle bone. So we need strength on both of those joints on either side of the knee. But the hip and the side of the hip here is super important. And almost everyone who has knee pain has weakness in this hip. It's called your hip abductors or your glute medius, if you want technical names. So this is the one I call the Jane Fonda exercise. Everyone kind of remembers the pictures of her and the leg warmers doing this. But it actually is a super important exercise. The key thing on this one to remember is make sure your body is totally in a straight line. Well, people who have weakness tend to bring that foot in front a little bit. And so it's important that the leg comes straight up to the side, totally in line with your body. You won't feel this one in your knee. You'll feel it on your side and the hip. That's where it should be. And then working the other way is the gastroc muscle, the one in the back. So up and down on your toes. Now, most people say, oh, I can do this. But here are my questions for you to kind of test out for yourself. One, when you go up and down on your toes, can you go all the way up as far as your toes will point? Or are you just lifting your heels about this high? Frequently, people are just lifting about this high. So you got to make sure that you are lifting those heels all the way up. And then my next question is, can you do it on one foot? Holding on for balance, but can you lift your whole body weight on one foot? So for a full amount of strength, when we say somebody's strength is normal, they can go up and down on one foot 8 times, 8 to 10 times, all the way up. If you have knee pain, this will be really hard. So this is why it's super important to test what you can do on one leg versus the other leg. Because if you have pain on the right, your left is fine. If you go up and down on both toes, what you're going to be doing is all the work on your left, and your right's not going to get any work. So it's really important to separate these two. And then one way to make it a little bit harder, I just put on the side, is to stand on a step or a curb, drop your heels off just a little bit. When we walk and take steps, that ankle bone is flexed a little bit. So we want to have power through your whole range of motion. So it's important to progress to having those heels dropped off a little bit. So 2 different ways to work on it, 1 leg at a time, and then with your heels dropped off. Okay, so those are my basic things that anyone who has knee problems needs to be doing. So how many and how often? So the stretches, which is the hamstring stretch and the gastroc, I recommend that you hold them for 20 to 30 seconds at a time and do 3 good long stretches. My story for everyone about stretches is if you have rubber bands and you just pull it out one time, stretch it out one time and let go, it bounces right back to where it was. But if you put those rubber bands around a pack of pencils and leave it on there for a week, when you take it off, you have this like flimsy rubber band. So our muscles are going to respond similarly. They don't need a really heavy stretch. They just need a little bit of stretch held a long time. So if you pull as hard as you can, you won't be able to stand 30 seconds. It'll seem like forever. So just a little bit of stretch held for a longer time. You will have more success and less pain, less irritation. For the exercises and the leg raises, I encourage everyone to work up to 3 sets of 10 of each exercise. If you can do 3 sets easily, then you need to add weight. And this is where people kind of fall off, is they're like, I can do those exercises. They didn't really help me that much. They seem too easy. Well, if that was the case, you have got to push it a little bit further. And if you don't keep adding some weight and pushing it a little further to gain some strength, you won't be gaining the support that you need and it won't be as beneficial. So it's important to push yourself a little bit. And when I say add weight on legs, on those straight leg raises, 1 pound is really all you want to start with. If you put on, most stores have weights in 2 or 5 pounds. If you're weak and then you start with 2 pounds, it's going to be really, really tough. So I encourage, if 3 sets of 10 without a weight is a challenge, then the next step would just be 1 pound and then 1 pound. So they do have adjustable weights where you add little lead pieces into it and they'll go from like 0.5 to 5 pounds. If you're going to invest in any equipment, that's what I'd say get. Because you can slowly do small increments, but still challenge yourself. The strengthening exercises should be done at least 3 times a week if you want to see progress. If you are very weak or in a lot of pain and you're starting really small, you may need to do them more often. If you're not doing them consistently, again, you won't see the progress that you want to make. And combining the strengthening with the recommended 150 minutes a week of cardio exercise. So that is American Heart Disease or Heart Association recommendation. So when you're having knee pain, cardio exercise sometimes seems out the window. It's hard to do. So that is a goal to get to, whether it's bike, walking, pool exercise, whatever it is that you like to do, that is a goal, because the better cardiac shape you're in, the better blood flow, the better circulation. It manages swelling, it manages pain. All of those things are really benefited by the cardiac exercise. So the thought here, the take home here is I gave you 5 basics. Those are really just the starting block. If you really are serious about getting rid of this chronic pain or being able to do more with the injury that you have to really work at it and you have to progress yourself. All right, I'm going to stop sharing and I'm going to look at the chat. Nobody threw out any questions yet. So here's your chance to ask me questions about any of that. I can go back over. Any questions? Everybody's pretty quiet. Okay, here comes one. So asking about the gels or the rub-ons. There is a new cream that is available over the counter called Voltaren. It used to be prescription strength, and it is an anti-inflammatory cream. It does have medication in it. It is not recommended with people with heart disease. But again, it's over the counter and people are buying it up and slapping it on all over the place. It can be very helpful. It's just, you just have to remember that it is a medication and you have to modify how much you do it, or how much that you use it. But the Voltaren can be extremely helpful if you want something that's a little bit stronger. Okay. Question, recommending for a quad injury or tear from 4 years ago without surgical correction. Okay, so if you have a muscle injury, tears in the muscle, which again is very common, you will have weakness after 4 years. I'm assuming that there's some weakness, and then that often will cause some pain in the knee joint. So one, going back to these starter things, get your flexibility. I showed you a hamstring stretch and a gastroc stretch. You may need to find a quad stretch that you can do, and that's going to have to be really slow, because with muscle tears, you tend to scar down at the part of the tear. So any stretching needs to be done very slowly. Other options would be to have someone work manually on and breaking down some of that scar tissue that forms in at the tear, so that the muscle works more efficiently, that it contracts and relaxes the way it's supposed to, so that you can actually build strength. So you can give me a yes or no if that helps answer your question. But definitely strengthening and stretching, and working out the scar tissue, which you probably will have a sore spot or tender spot at the side of the tear. Any other questions? Okay, so that was just kind of, the starter overview. The big takeaway is there's lots of things you can do to manage knee pain, but you have to be proactive about it. You have to work at it. It doesn't just automatically happen. And if you are having trouble getting started, if it's hurting, that's when you go see a professional. That's when you go find a physical therapist in your area. Obviously, we are here to help out. If y'all have questions, y'all can always send me an email. I'll type into the chat here my email address, that if you have more specific questions, I can try to answer. Here we go. And that's about it. All right, well, thank you guys for hopping on. And oh, I got one more question here coming. And you can always unmute and ask it if you want. Exercise sheet, yes. If you want the exercise sheet, if you could just send me an email, just saying yes, exercise sheet. You saw my address in there, and then I can just respond to it and I will attach it. Does that work? So Catherine@bluewavept.com. It's pretty easy. And that will have the ones that we just went over there.
Thank you. It was really interesting to hear about the knee replacement stuff, and because you hear that all the time, and to know what's actually involved. I knew they cut your bone, but it's kind of horrifying, actually.
Yeah, it is a really aggressive surgery. Now, the reason they're doing so many is because there are a lot of good results. There's people who are really glad they did it. But most of those people prepare for it. And if you prepare ahead of time, it makes it so much better. And so
my
the recovery.
sister prepared for it, and she's in really good shape and all that. And her knee she's never been able to bend it the way she can't do yoga anymore, which she did. She rides a bicycle a lot. I mean, competitively even now. Okay. But yeah, she did everything right and it still didn't turn out. So I have been very leery of anything like that.
Yeah.
Because of that.
Well, keep in mind that you hear the negatives 5 times more than you hear the positive, because all the people who had a good result, they don't talk about it and they've like gone on their way and they're doing fine. So take that, just kind of know that for every bad story you hear, there's probably 3 or 4 good ones.
Yeah.
But at the same time, a knee replacement is never as good as the original. With all of these surgeries, it's It's never as good as the original. So as long as you can keep the original, the longer you can keep it and manage and do the things you need to do, that's what I encourage there.
Well, thank you.
Okay. All right. Well, y'all have a good evening and thanks a lot.
Yep. Bye.
Bye-bye.